Everybody gets them, but when do you worry about blood dripping from this body part?
Hi doctors. I was wondering, if you come upon somebody with a nosebleed, how do you know if it's just a normal nosebleed that will go away or if it's an emergency and they need to get to a hospital?
Well, anyone who's had a severe nosebleed knows that it can be, number one, frightening and potentially life-threatening. So today we're talking about emergencies. When is your nosebleed an emergency? And it really comes down to two things: the amount of blood that's coming out of that nose, and number two, is it responding to what we're going to tell you to do when you get a nosebleed? So let's start by showing you some volumes of nosebleeds. So we have a little bit of a trickle, and that is not a large amount of blood. Whereas on this other side, now that is a gusher. And the rule is, in general, if your nose does not respond to 15 minutes of pressure, pinching it, leaning forward, a little ice, and you're bleeding half a cup or 125 cc's, which translates to about 2 soaked washcloths, that's what I would consider to be enough blood coming out of your nose that you need to have that looked at in the emergency room. So in a severe bleed, what potentially can cause that? Well, typically it's in the older patient. It's high blood pressure, it's being on blood thinners, it can be trauma, like you said, Dr. Travis, it can be a tumor. There's certain congenital conditions, hereditary hemorrhagic telangiectasia, which just means the blood vessels inside the nose are very sensitive.
And the one thing I want to add, because we're talking about bleeding from the mouth, is a gusher, a true gusher of nosebleed. We've seen this where there's so much blood, and a lot of times it's not going to even come forward. It's going to go the least resistance pathway back into the back of your throat, potentially into your airways. That's where it doesn't matter how much pressure you're holding. That's where you got to go ahead and get to the ER right then and there, so that we can protect you from essentially asphyxiating your own blood. Thank you, Dr. Orden.
All right.